We're just gonna kind of quick time go through these. I'm not gonna go through all the forearm ones. There's like 8 and 9 on either side, but here, this muscle model is trying to show it. That coracobrachialis muscle is right there. And if you look at the picture in your book, what it's showing is how this muscle attaches onto that coracoid process, that hook of the scapula. Remember the acromion, coracoid process, and attaches onto the humerus. Oh, I got the wrong one, didn't I? This would be the wrong arm, God. But, well, what am I doing? Here's the humerus. So, all right. So coracobrachialis attaches from here, this anterior hook of the scapula, onto the anterior side of the humerus. It's underneath your biceps. And so when it shortens, its action is going to be just moving the shoulder forward into flexion. That's its concentric action. And again, what we're going to be talking about predominantly is the actions of muscles when they shorten. So coracobrachialis is right there. And if we keep flipping, then we'll be to, I assume, a bicep brachii. I might have to keep flipping. Yep. We might have missed bicep brachii, but there should be bicep brachii. There's brachioradialis right here. And underneath bicep brachii here is also brachialis. Okay. The top muscle, if I go in reverse, bicep brachii, that's the one that is most famous, you know, flex bicep. It's the only one that crosses two joints. All right, now it's going to correlate to these hamstring muscles. There's elements of function. We're going to start with this, the kind of broad spectrum blueprint that the muscles of the shoulder are going to parallel with the muscles of the hip. Okay, this is part of that whole cross-body contralateral reflex that we need to be able to walk around effectively. All right, but there's going to be some issues here once we get to the knees. Predominantly, if we were to cut the legs off, you know, midway at the femur, all of your flexor muscles, this chart isn't great because it has the hands pronated, but all of the muscles of flexion, the big flexion muscles, are just on the anterior side of the body. Anterior shoulder, anterior elbow, anterior forearm, anterior hand. All flexors. Every single one of them. At the hips, flexors. The knees are on, think of it backwards. If we looked like ostriches, it would make life easier, but we don't. Our knees bend this way. That's knee flexion. This is elbow flexion. So the flexors of the knee are on the posterior side of the body, not the anterior. So you have to kind of flip that one over. But shoulders and hips, both anterior in terms of their flexors. There's some things here where there's only a couple muscles. There's always going to be the most surface ones that do two jobs. They cross two joints. All right. So looking at this chart, you can see it hamstrings. There's 3 of them. They cross the knee, but they also come up here and they attach on the pelvis, meaning they move the hip joint as well. Bicep brachii, which there's 2 elements to it, but you can really think of it more as one muscle. It crosses the shoulder and the elbow. So there's a neurologic idea here of how these muscles interact as we coordinate our body contralaterally. The triceps, also, there's a long head of the triceps that crosses up and attaches onto the scapula, similar to how the hamstrings do, meaning they function at this big one at least, functions and moves the shoulder into extension. But down here, all 3 of them move the elbow into extension. That is just like with the quadriceps muscles, which it's easier for me to show on this, that The leg muscles, it doesn't work perfectly, but in this case, there's an extra one. Not this one, that's the sartorius. That one doesn't really have a paired one, it's its own unique thing. But the quadriceps muscles, 4 of them, the top surface one, rectus femoris, functions there at the hip, attaches right onto the anterior superior iliac spine. So here it's a hip flexor, down here it attaches into the patella, crossing the knee, meaning down here it's a knee extensor. The other 4 quads, okay, there's a lateral one, a medial one, and an in-between one to make up the 4. All of those don't attach at the hip, they don't pass the hip, they only work at the knee. So all 4 quadriceps muscles are knee extensors when they shorten. Only one quadricep muscle is also a hip flexor. The triceps muscles, there's 3 heads to it. You can call it the triceps, but only one head of the tricep affects the shoulder and extension. All 3 of them, though, work at the elbow. Okay? But there's a kind of a cool correlation that here in the upper leg and the upper arm, the muscles and how they're designed is very similar. You have surface ones that work at both the hip and the knee, both the shoulder and the elbow. And then you have the rest of them that will work just at the knee, just at the elbow. Okay? Neurologically, the way this is taught is hamstrings are paired predominantly with the biceps. The triceps more with the quadriceps. It gets a little bit nuanced if we think about the hip function though, because hip flexors should go with shoulder flexors, knee extensors should go with elbow flexors. So there's some things here that it doesn't always match up perfect, but it gives you a pretty good roadmap. Once we get to the forearms are going to be one of the crazier things. But there's pretty much, if you keep flipping in your books, you'll start with the anterior muscles of the forearm and hand. So all of these, okay? There's a bunch of surface ones. There's like 4 surface ones. And then there's a middle range one. Maybe there's 5 surface ones. Then there's a middle range, a middle depth one. Like there's truly 3 layers of muscles here, okay? Then we go deeper. Come here, let go. I said let go. And you get even deeper. So at least 3 layers of muscle here on the anterior forearm, okay? And that initially is all you need to really worry about. We talked a chunk about this last week, where if you're going to work here, up here is where you have the most bulk, this proximal half of the forearm. And remembering that all these flexor muscles, see how even the deep ones come and they attach there on the medial epicondyle of the humerus. Okay, so medial epicondylitis, golfer's elbow, it can be associated with all kinds of forearm and wrist issues. And this is where we want to focus, as well as a little bit here, but you're safest initially really working here because that's where the most layers are. You get the most sliding more independently, and then the muscles that function at the wrist versus the muscles that function just at the fingers can all have some slip and slide. Right? Now, if we keep flipping in your books, so there's, I believe, go ahead and count, if you look at it, I count these things up. This is one way that I try to think about trying to memorize muscles in the future. When you come back to this, count how many muscles there are in an area, in a region, and then that gives you a standing point of just remembering at least how many you're looking for, okay? So I believe there's 8 here on the anterior side, and there's 9 on the posterior side. That numerical trick has helped a ton with trying to get some recall figured out, and these kind of are checking the boxes as you work your way through But do that anywhere and everywhere. You get to trying to look at like the intrinsic muscles of the hand, specific to the thumb. As a general rule, my suggestion is identify how many there are there, and then go from there. Now these, what's nice is the anterior forearm muscles will predominantly have the name flexor, or it may in them. So the flexor digitorum longus. There's a few different ones, but like if we can remember, the palm is the anterior side, there's palmaris. There's going to be a flexor carpi radialis. What side of the arm is the radius on? The thumb side. Okay, so if it's more on the lateral thumb side and it's a bigger one, it's probably a flexor carpi. Or if somebody asked you, where is the flexor carpi radialis? It's got to be up here on the anterior forearm on the lateral side. Flexor carpi ulnaris, it's on the ulna side. So it'll be on the medial side of the arm, all right? If it's a flexor digitorum, it's moving all the digits. So if you had a visual of it, it will run from here, go all the way down, and have tendons that go to all the individual fingers. If it says pollicus or indicus or digiti minimi, it's talking about one digit. All right, so pollicus is going to be a thumb. You hold onto a pole with your hand, so pollicus, versus hallicus. Hallicus is the toe. But the muscles here, you have more here than you do here in the leg. The leg muscles are bigger, but they're actually going to be easier than these forearm ones. But from a practical standpoint, I've usually thought more from that idea that there's a surface group that's going to be about wrist or all the fingers, okay? Deep to it may be some specific ones, like for the thumb. The thumb has some big muscles that come all the way up onto the forearm on either side. Once you're halfway down, right down here, then you're going to get more into individual finger muscles. On the lateral side, some muscles that maybe move just the pinky. Over here, kind of more central or lateral muscles that maybe just move the second phalange, your indicus finger, so the muscles will be called indicus, versus the thumb, and those would be called pollicus. But if it's a flexor pollicus, it has to be on the anterior side. There you go. If it's a flexor digiti minimi, lateral side, okay? Come over, it's going to be the same thing, and it's going to be extensor digitorum longuses and extensor carpi radialises and extensor carpi ulnarises, and there's an extensor superficialis, extensor digitorum, extensor pollicus, extensor digiti minimi, extensor indicus, and you just keep going from there. They really mirror each other. There can be like an extra one over here and all that, but you learn one side, it helps you learn the other, and remember the bones, and remember anatomical position, because that'll help orient you. If it's pollicus, gonna come up and be on the lateral side, versus a digitorum longus, or an extensor digitorum longus, flexor digitorum longus, extensor digitorum longus. It's gonna start up here, and the tendons will go to all the fingers, kind of a deal. All right. The hand, we're just going to talk about the group. This is called the thenar group. Bunch of muscles just for the thumb. Hypothenar group that are associated with helping your pinky come over and do this apponens action. So important for gripping things, all right? It's a case where carpal tunnel and wrist issues, symptoms will manifest here at these places where there's these bony prominences, like the styloid processes, and where the tendons and ligaments have to either connect the bones or connect the muscles to the actual digits. Very tendinous through all here, right? Here at the carpal tunnel, just ligament and tendon, right? What does that attach to? Oh, the hypothenar and thenar muscles. So somebody has carpal tunnel, they have wrist anything issue. If the wrist issue is more on the thumb side, then I need to pay attention more to the radius and the thumb side of things. If it happens to be over here, which is a bit less common, then sure, I need to think bigger up here if it's at like a wrist joint thing. But if it's coming down and getting to the hand, one of the best things we can think is like, how do I create slack for this? If these muscles are tight and rigid, they're gonna pull and cause tension on that carpal tunnel. So we don't have to dig here, but that's why it would be important to affect this chunk of muscle and this chunk of muscle. Right? Not too bad. Okay. There you go. The leg has a lot of similar correlations. So we just talked about the carpal tunnel. Oh, one thing I think I've mentioned this before, but as you move forward, another thing for remembering these is going to be if it has B-R-A-C-H in it, brachii, the coracobrachialis, bicep brachii, brachialis, brachioradialis. Those are all the muscles that either, except for deltoid, which I'm going to talk about deltoid here in a minute, but all those muscles I just said, they have brachii in them. They're either shoulder flexors or elbow flexors. They're on the anterior upper arm. All of them, and the only ones you have to worry about that have those weird names to them. So it has brachii in it. It's here, somewhere. And then you just have to remember which one it is. Coracobrachialis, if the coracoid process gets to your mind, then great. But brachioradialis, right? Breaking that term down. You hear it at first and you're like, well, that's a weird name, right? But brachio, okay, anterior upper arm, works at the shoulder or the elbow, but it has radio in it, brachioradialis. Do you think that has to do anything with the radius and the ulna? The answer is yes, it attaches on the radius. So the brachioradialis, although it's predominantly an elbow flexor, that's this one. You kind of see the muscle here. That's that one, okay? But that's how you could dissect the name if you saw it on a test, right? It says brachioradio, well, it's on the radius, so it's gonna be down at the elbow, and it's gonna attach onto the radius, okay? But brachii something. Now, we get here, and at this point, let me do my blah on deltoid. Deltoid is not a muscle that people pay a lot of attention to, mostly because it can be kind of hard and awkward to palpate. You'll feel like when you're working here that you're feeling, not a ton of muscle bulk on most people, right? But visually, I want you to get a sense of how big it actually is, regardless of how bulky it is on a person, okay? A bodybuilder is one thing, but the average person that doesn't need to lift, 100 pounds laterally, it's not gonna have a ton of mass to it. But reflect on how it attaches so far back onto the scapula and very anterior over here, potentially on the influencing the clavicle. So very anterior sections of this fiber, very posterior sections for these fibers. So this section of deltoid, when it shortens, is a shoulder flexor. And since it's right there on top of the shoulder, this is supposed to be the boss of shoulder movement, all right? It ideally should be good and strong for people. It doesn't have to be big, it just has to be, willing to work. Okay, anterior is flexion, posterior, extension. So you learn this as one muscle. These are antagonistic to each other. So somebody has shoulder asymmetry, okay? It's something we have to pay attention to. And also here, this lateral, intermedial deltoid, because we could break this into three pieces: anterior deltoid, intermedial deltoid, posterior deltoid. And the fibers here that would be just on the lateral side of the arm, this is how it would be on somebody, right? That's supposed to be my most important abductor when it shortens. So, yeah. So this muscle that kind of hugs around that entire shoulder joint Look what's underneath of it. Very little. But look how far down it comes onto the humerus. It is basically the most important muscle regarding this action, shoulder abduction. And when people get shoulder injuries, does not matter the cause, this is the #1 limited mobility issue they have, is they can't get their arm out to their side effectively anymore. And if they go into physical therapy, stuff like that, they'll focus predominantly on strengthening supraspinatus and deltoid so that a person is stronger there. Okay, one muscle, but think of it in 3 parts. Okay, 3 is the magic number. Hugs the ball and socket joint of the shoulder, should be in charge of the shoulder joint a little bit. Compare that to the glutes. Visually, don't get lost even though like shoulder flexors with hip flexors, elbow flexors with knee flexors, very anterior posterior. Here, don't make the mistake that pecs are paired with glutes, okay? See this heart-shaped thing hugging the shoulder joint? I would call it spade-shaped thing. Spade-shaped thing hugging the shoulder joint, spade-shaped thing hugging the ball and socket joint of the hip. So hip to shoulder, deltoid to glutes. But the glutes truly do have 3 individual muscles. Gluteus maximus, most posterior, but there's 3. So if we can think of the deltoid in 3 sections, we can think about the muscle. It parallels with the glute muscles in 3 sections. Gluteus maximus, the one that's the most posterior, on the posterior. Then we have gluteus medius, and deep to that, gluteus minimus. So this will be the place where you are identifying an iliac crest and coming inferior to that to be really good on gluteus maximus. Then you're coming over and you're usually palpating, you're finding the greater trochanter, and coming just superior to it is in this concavity here, that is gluteus medius and gluteus minimus. People get bad hip issues. There, even a bursitis that can occur right over top of here. By working here, we can create some slack and help that. But 3 glutes, and the glutes really should be the ones that are first actors at moving your hip into extension or abduction. They're even involved a little bit, those gluteus medius and minimus are involved with some internal hip rotation, okay? Once we're to the rest of this, I have here at least a nice numerical trick for memorizing these, okay? So 3 hamstrings. Okay, I'm gonna remove the glute. That's what I meant to do. 3 hamstrings. 1 is very lateral, and it's called biceps. Biceps femoris, biceps brachii. But I see biceps of the brachial plexus, brachii, anterior shoulder block. Bicep femoris on the femur, so not too bad, but that's the big lateral one, okay? Then there's 2, so that's this one right here. Bicep femoris comes down, it attaches onto the fibula, the fibular head, this thing, okay? Then you have 2 more on the medial side of the leg, and they're semi-something, semi-tendinosus, semi-membranosus. Tendinosus is on top, okay? And if you look at these charts, you'll see a little slip of semi-membranosus, more medial, more to the middle line. But 3 hamstrings, yeah? If you know at least there's 3 of them, you can work your way from there. A bicep something, there's a bicep here that works the hip and the shoulder, sorry, the hip and the knee. There's a bicep here that works at the shoulder and the elbow, bicep brachii, bicep femoris. Then you know there's other brachii somethings here. You know there's a semi-something here. Semi-tendinosus is on top of semi-membranosus. 3 hamstrings. How many quadriceps? 4 quadriceps. A rectus femoris, it's on the femur, and then vastus something. Vastus for its positions. Vastus medialis, vastus lateralis, and then underneath of this, vastus intermedialis. At least, obviously you're looking for 4 with the quads. The thing to eliminate from this whole anterior leg thing is the sartorius, initially. So the sartorius isn't part of the quads, only rectus femoris and the 3 vastuses are part of the quads. 3 hamstrings, 4 quads, 5 adductors. So I've removed the hamstrings and sartorius so you get a sense of their distinction. But there, 5 adductors. Those aren't named too bad. Like one's named gracilis because it's like gristle, very thin. There's 3 more that are just named adductor something based on their size. Adductor magnus, adductor longus, adductor brevis. And then there's a weird one deep, deep, deep up there called pectineus. Since it's an adductor of the hip, your pecs are adductors of your shoulder. So you have a pec in your adductors. This is all repeat. All right. 3 hamstrings, 4 quads, 5 adductors, 6 deep lateral hip rotators. Doesn't look like 6, does it? But there's 6 deep lateral hip rotators. Most famous one being piriformis. Then you have 2 gemelli, 2 obturators, and a quadratus femoris. But those names might drive you crazy, but at least you know there's 6 of them to look for. 3, 4, 5, 6. And if you can come up with any other system, share it with each other, and that's great. All right? To remember with sartorius, to wrap up the anterior upper leg, is that tensor fascia lata. See how they create like this upside down V shape, right? Sartorius comes all attaches with your hamstrings, your medial hamstrings, semimembranosus, semitendinosus. I think it's more specifically tendinosus. They attach right here on the medial side of your tibia, and that comes all the way up to the ASIS, anterior superior iliac spine. Tensor fascia lata completes this V formation and then comes over and balances that out, along with the lateral hamstring, bicep femoris. Your IT band and bicep femoris, that lateral hamstring, attach onto that fibular head. Then come all the way up. And IT band does smear into the glutes, but tensor fascia lata, this little muscle, is the one case where the tendon is bigger than the muscle. But they unify up here, and both of these muscles are hip flexors as their primary action, and they have some extra things involved with what occurs here. But that completes kind of everything here. There's these 2 on top, along with rectus femoris, and then all you have are the 3 vastus somethings. But this is big split in unification, and that's why working here at that hip flexor section is so essential, because you're covering 3 muscles, all of which, all 3 of these do hip flexion, but then after that, they do very different things further down at the knee. So if there's confusion here, it causes confusion everywhere, okay? Once we're further down, it isn't too terrible, okay? You have your big calf muscles that become the Achilles, okay? What this is, you have gastrocnemius, which is the heart-shaped one. You have soleus, and I remember that kind of like the sole of your foot or the sole of your shoe, right? There's something underneath. So soleus. There's also, with soleus, plantaris. Plantaris doesn't get talked about a lot, but those 3 come together to become the Achilles tendon, okay? Now, there are deep muscles here. There's a deep muscle here. The really tiny muscles in some of these areas are going to be not always more confusing, but they have some strange names. Like this one's called popliteus. There's a deep one here called anconius, and you just have to visit those a bunch. Some other forearm ones we didn't cover are your supinators, pronators, but that's not so bad. Pronators, very deep because they have to connect the radius to the ulna. Pronator, pronator, supinator. That's all there is to that. But here, you have the 3 Achilles muscles, and then we're to the muscles that would parallel those extensor flexor muscles in your forearms for either your wrist or your fingers. So these muscles, now those Achilles muscles are important for that plantar flexion. To fight gravity, you need something really big and powerful here, right? So that Achilles tendon is made of some tough stuff. And soleus is one of the strongest muscles in your entire body, along with masseter. So that muscle right there that's underneath gastrocnemius, by size, it's pretty much the most powerful muscle of your actual moving limbs, all right? This one. About halfway down, this stuff gets tight. That's why the calves are such an issue for people, and why making sure these are mobile is so important. But it's the stuff underneath as well, right? The stuff underneath these big muscles that become the Achilles, and all they do, gastrocnemius is the one that actually goes behind the knee. So gastrocnemius is a knee flexor as well, but then it, with the other 2, all unify and they all together work at the Achilles tendon, and they shorten, plantar flexion, plantar flexion. Underneath of that, we have this deep posterior group. We come around, we have an anterior group. The names here, thankfully, perfectly mirror each other, okay? And these muscles now, where we're at, only function at the ankles and the toes, okay? You don't have anything here. You don't have anything here that works at the knee and the ankle. The only muscle of the lower leg that works at the knee and the ankle is gastrocnemius. After that, it's only ankle and toes. Here, there's a tibia. Tibialis anterior. Tibialis posterior. Extensor, if I trace this, extensor hallucis, hal for big toe, P-O-L for thumb, extensor hallucis, flexor hallucis, I'm making kind of a guess, flexor hallucis, extensor digitorum longus, flexor digitorum longus. That's it. The deep posterior side of your lower leg, the muscles that produce a little bit more your the tibialis anterior and posterior, but also these, they're your main dorsiflexors, ones that help pick you up. So they're supposed to counterbalance, tibialis anterior, all this stuff, dorsiflexion. You still have plantar flexion here, but they mirror each other perfectly. Then you just have this lateral piece, and these all sit on the fibula, 2 of which go back behind that lateral malleolus. All of these muscles go behind the medial malleolus. So between the calcaneus and the medial malleolus is this tunnel. I've heard it called the tarsal tunnel, just like this is called the carpal tunnel. But it's there on this medial section of the ankle where all those cross over. They go through the arch of your foot, which then has muscles on top of it, these intrinsic muscles of the foot, and go to the and either function just there, but you have 2 of them, one specific to the big toe and one for all of the toes. And it's a case where just finding a way to dig this far is going to be painful and awful. but to think while we work that we mobilize the Achilles muscles and free those up will be helpful. Finding a way to effectively work on this without hurting ourselves. When a person lays supine and their legs tend to externally rotate, makes it hard for us to get leverage, right? So either you need to really turn them in supine to work here, or you're best suited to just put them on their side. And then you can come right against them on an angle or right on top. These lateral muscles that I mentioned that sit on the fibula, their old name was peroneus. That's named for the nerve that innervates them. But peroneus longus, peroneus brevis, and peroneus tertius is the one that flips over and decides to be on the anterior side of that lateral malleolus. But regardless, 3 peroneuses. You have to somewhere in your brain go peroneus, fibularis. Peroneus, fibularis, they're synonyms, okay? The old way of calling these is peroneus. It may show up in a test. It will certainly be in some literature that's older. The new way of talking about it that's much better is fibularis, because then you just know. Like tibialis anterior, tibialis posterior, guess what bone those attached to? Versus fibularis, longus, brevis, tertius. And the longest one, guess what? That's the big one. Brevis, a little bit smaller, tertius, even smaller. But longest, right on that fibular head. So this is where identifying the fibula, which I can't feel all of it, but I can find the fibular head, I can find the lateral malleolus, I can track where these muscles are. And then there's these cool conjunctions, right? We have the one big muscle, fibularis longus, that works here down at the ankle, attaches onto the fibular head. What else attaches into the fibular head? The IT band, bicep brachii, bicep femoris, Jesus. Bicep femoris, which comes up, attaches into the ischium of the pelvis. Those ligaments smear into like elements of the sacrum, and you just can keep on drawing these patterns of where one thing kind of blurs and turns into another. And then we start getting into bigger and bigger correlations of the body. Okay. Any questions with all that? We're going to do one more painting here. And then we're going to spend a little bit of time looking at those models, having each of you kind of just stare at the pictures, pull it apart, put it back together, just give it a good gander.